Hi, I'm Angela. Congratulations on getting your braces on. I'm going to be teaching you how to take care of your braces. Keep them nice and clean, your oral hygiene while you're in treatment. This is your home care pouch. It has everything in it that you need to care for your teeth and keep them nice and clean while you are wearing your braces. We're going to review everything together. This is your new toothbrush. Floss threaders, travel brush, floss, 2 interproximal brushes, very important. I'm going to show you how to use those. A timer to be sure that you're brushing your teeth for the right amount of time. Wax for poking wires, and a chapstick. Okay, so how we're going to begin is by showing you how to brush your teeth, the way that you need to brush while you're wearing braces. The proper way to brush your teeth is in a circular motion, like so. Okay, so you're going to need to do 3 different positions: straight, angle up, angle down. Okay, I'm going to open this model to show you. You're going to brush your teeth as you always did in a circular motion like this and keep your brackets nice and shiny and clean. But most importantly, you're going to need to focus on your gum line. You need to angle your toothbrush like this, on an angle. Brush the gum line very thoroughly, on an angle, all around, circular motion. Very good to go back and forth as well. Massage the gums, take your time. Then, 3rd position, below. When you're going above and below, it's very good if the toothbrush bristles go below the wires, underneath like this. Don't be afraid of that. So you need to do this. You need to especially focus on places where there are any attachments or hooks. Really go and focus on those areas so that you can get them nice and clean. Now you will be doing this for 3 minutes, 1.5 minutes on the top, 1.5 minutes on the bottom. Ideally, it should be 30 seconds in each position. 30 seconds in this position, 30 seconds in the flat position, 30 seconds in this position. How you know is you're going to use your timer. The timer has sand in it. It should be empty on the top. You're going to flip it over, tap it, look in there, be sure that the sand is falling. When you see that the sand is falling, that's when you will begin. Half the sand for the top of your mouth, half the sand for the bottom arch. 30 seconds on this angle, 30 seconds on this angle, 30 seconds on this angle. 1.5 minutes on the top, 1.5 minutes on the bottom. Now, flossing. This is what we call a floss threader. We're going to take, looks like a sewing needle. We're going to take a piece of floss. We're going to put it in our floss threader. We're going to thread it. Okay. And it should look like this. Just like that. Okay. So what you need to do now is take the floss, go below the wire, pull the floss through, bring it down, hug each tooth on each side, like that, and like that, pull it through, and then go to the next. Put it under the wire, pull it through, pull it in between your teeth, hug each tooth on each side with this floss. Don't snap it in, you'll make your gums bleed. Do it gently, but clean it well, pull it out, and that is how you're going to go in between each tooth and go under the wire. It may take a little bit of time, but as you practice, practice makes perfect. You will get it. It will get easier every night, this whole routine. You also have something called a proxy brush. Let's speak about proxy brushes. This is a wonderful tool to have while you're wearing braces. This proxy brush is excellent to clean your gum line. So once you've brushed and flossed your teeth, it's a very good idea to do a fine-tuned cleaning of your gum line. And what I mean by that is take your proxy brush, put a little bit of toothpaste on it here, go around the gum line like this, and you can go in between the braces like this. Very quickly, it's just an added step to be sure that your gums do not get bleeding, swollen, tender to the touch. If you do have any bleeding or swelling anywhere on your gum line, that is your body telling you and your mouth telling you, come here and brush more. So don't feel intimidated, if you see any swelling or it feels tender or there's any bleeding, that is letting you know that you need to come here and brush this area a little bit better and a little bit more thorough. That's where you would especially want to use this proxy brush. You can go right along the gum line like that and in between the teeth like this. You will have a second one because this is a very good thing to carry with you when you are out and about. You're not at home, in school, for lunch, occasions, parties, anywhere that you will be eating. It's a good thing to have a proxy brush with you in your bag, in your pocket. When you wear braces and you are eating, most likely some things are going to get stuck in between your braces. You don't want to sit with foods remaining in your braces. You want to go like this with the brush, and anything that you eat gets stuck in between your braces, you just very quickly go like this. For the next day or two, you can practice in the mirror, but after that, you will definitely be able to do this with your eyes closed. It'll be 1, 2, 3, no big deal. Okay, now we went over brushing, we went over flossing. You have a lovely travel brush. This is an option to take with you when you go to school. If you can brush in the middle of the day or go on a trip, it just opens up like this. And you put it together like that. Okay. Now, we went over brushing, we went over flossing, we went over the interproximal brush. Next, we're going to speak about foods, breakage, and wax. So, foods. As far as foods are concerned, it is the sticky and hard foods that you need to not have while you're going through treatment and you're wearing braces, because it will break your braces. It will pull your braces off. Things like apples, peaches, pear, corn on the cob, carrots, things like that are very healthy for you. Don't stop eating them because you can't wear them, eat them while you're wearing your braces. These things you need to cut up into pieces and place these pieces in the back of your mouth, on your back teeth, and chew with your back teeth. We don't want you to have anything where you're biting into it like this, or you're biting and you're pulling, things like that. You need to cut up, put in your mouth, chew on the back teeth. Things like pizza crust, big soft bagels, big soft pretzels, things like that. Break it with your fingers, break it in pieces, place it in your mouth, chew it on your back teeth, rather than performing the motion of biting and pulling. Break things that you need to bite and pull. Think about it before you do it. You don't want to wind up with broken brackets. Just break it in pieces with your finger, place it in your mouth, chew it on the back teeth. Things like nuts and popcorn and ice cubes, hard things, sticky things. Please refrain from having these things while you're wearing braces. Your treatment, a lot of your treatment length, the time that you spend in braces, has to do with your compliance. If you come for all of your appointments and you eat the things that you're supposed to eat in the way that you're supposed to eat them, you will finish on time, maybe even early. Patients that do not come for their appointments, that eat these sticky and hard candies and nuts and things that they're not allowed to have, tend to stay in treatment a lot longer. So keep in mind, you'll get your braces off very quickly if you're in compliance with all of our instructions. I'm going to show you this sheet about all the foods here, and we're going to go over these things. So we spoke of hard candies and sticky candies. They are absolutely out of the question. You can have things that melt like chocolate, not a problem. Ice cubes, below here, pencils, pens, water caps. Sometimes patients may have habits of playing with pencils or pens or water caps or different things in your mouth. Please do not do these things while you are wearing braces. You will break your braces. If anything is broken or you break anything, please call us, advise us, let us know that it is broken. We will let you know if it is something that can wait until your next appointment, or if you need to basically come in soon. In the meanwhile, while you're waiting to come in and visit us and have whatever is broken repaired, sometimes we can have things poking and sticking us when we're wearing braces. We've got a lot of metal in our mouth. So we have to keep that in mind. That is what your good friend orthodontic wax is for. This is a fantastic thing to have when anything is poking you or sticking you. What this is sticks of soft, sticky wax. Very, very helpful when something is hurting you. It will stop the poking and the pinching immediately. What you will need to do is, it's soft sticks of wax. You're going to need to take off a portion of it, like this. You could use your fingernail, you can use a butter knife, you can use anything you need to use to break a little piece off. It's very soft. And you're gonna roll it up, like the size of a garden pea, like the vegetable pea. So wherever something is poking you in your mouth, you roll up a piece of wax like this and you prepare it. But very important, whenever you're going to place wax on a bracket or anything that's poking you, it will not stick well if you have saliva there. If the area is very wet, it is not going to stick well. We know it's in your mouth and we know it can't be perfectly dry, but do the best you can to take a little tissue, have the ball prepared, pat wherever it is that it is poking you, and you're going to put it right on the offending area. Press it on all around, put a nice big piece. It's very soft like a cushion. It will immediately stop whatever is hurting you from poking, so you should not get a canker sore. You need to wear wax for a couple of days before you see us, and you swallow it while eating a meal. It's nothing to panic about. It's okay. It doesn't hurt your stomach. It's not going to hurt you in any way. Just dry the area and put another piece of wax on there and keep it covered until you get to us, and then we will repair it and make sure that you're comfortable before you leave. Just don't forget about drying the area. As far as comfortability while you're wearing your braces, the next couple of days you're going to need to take Advil or Motrin. That is the recommended pain medication. It is much better than Tylenol in this case. You would take the dosage just as you would for a headache. Same dosage. You'll need to be on Motrin or Advil for approximately 3 days. Warm salt water rinses are very helpful. You have a lot of metal in your mouth. The tissue in your mouth is not accustomed to having metal against it. It could become irritated. Salt water is excellent. A couple of times a day, as many times as you can. Take a cup with warm water, put a teaspoon of salt in there, rinse very well. Be sure to bring the liquid to the front of your mouth. You're not gargling like this. You're bringing it to the front of your mouth like that, and you're going to swish it all around the tissue. This will help in toughening up the tissue. This will also help for any irritation that you may have. It will promote healing. The irritation will heal very quickly due to the salt water, and it will prevent infection. Salt water is a wonderful thing. Please be sure to rinse with warm salt water for 3 days. Take Motrin or Advil. Cold, mushy things are very comforting to sore teeth. You're going to need to have smoothies and ice cream, lots and lots of ice cream. Take advantage of it. There's no other time in your life somebody's going to tell you to eat a lot of ice cream for 3 days. You can take things like desserts, applesauce, pudding, yogurt. Put these things in the freezer, make them very, very cold. Cold, mushy things are very comforting to sore teeth. If you're having any problems, please feel free to call us. We're in the office every day. If we're not here, we have a contact emergency number on this phone when you call on the voicemail, or you can email Dr. Halaby directly. The email goes to his phone. He's excellent at replying right away. The email is on your pouch. His email is right on the bottom of this card. It's drelliebraces@gmail.com. He's very good at answering, replying right away. It goes directly to his phone. Your second option is when you get the voicemail, there'll be a phone number listed on the voicemail that you're welcome to call. And we'll help you over the phone until we can get you into the office with any issues that you may be having. Understand there are no real emergencies in orthodontics. It's more like issues that we can help you with very quickly and make you be comfortable until you can come in for your next visit. You'll be returning to the office in about 6 weeks for your first adjustment. We look forward to seeing you then. And keep in mind, you must visit your dentist every 6 months. It's important at all times, but even more important while you're wearing braces. Please visit your dentist every 6 months for a professional cleaning and a checkup. Make sure that everything is okay. Please visit your regular dentist every 6 months while wearing braces. I'm wishing you the best of luck during the course of your treatment. If you need anything, my name is Angela. I am here to help you. Good luck. We'll see you next time.